And we have another speaker to speak, and that is another past international director, Michael Osur, our co-chair. Building health into everyday life. Building health into everyday life, Michael Osur.
We are all public health. As you know, I've retired in October last year from public health, but we still live public health every day. Now, some people do public health like Ed does it. He's teaching, if I count correctly, over 100,000 people CPR. The potential for all those people to save lives is huge. And I was a paramedic in the early 80s in Oakland, and we saved a lot of people, but it was one at a time. When we think about public health, we're saving a community. We call it public health. Public health 101 is what we traditionally think of. Stopping the communicable diseases like TB or cholera, smallpox, and we succeeded so well that we then created the next issue we call Public Health 2.0, where we have to deal with chronic disease, diabetes, cancer, everything to do with high cholesterol, because we've created this world where nobody could walk. It's a sedentary lifestyle. So then how do we deal with those? Now, some people say, oh, we have bypass surgery, we have medications, we have drugs, but that only takes you so far. Now, COVID aside, we'll come back to that in a minute. The more concept now as public health changes, and by the way, none of us were taught this in public health training school, masters in public health, though they're training it now. We call it Public Health 3.0. It's where you work within the community because the community knows best what they need to be healthy. Now, when I look at it, that's what I call building healthy communities, because how a planner plans a city determines the health of the community. If there's wide sidewalks and bike lanes and central plazas and squares, and people can walk to what they need to do or easily ride a bike or take mass transit, they will be healthier because they'll walk more, they'll be more physically active, they'll have opportunities to eat better. Think about if we made the healthy choice the easy choice. Imagine, I don't go to McDonald's, but imagine Lisa's at McDonald's, and right, and whatever you ordered, it came with hummus and chopped vegetables, and that you'd have to beg and pay extra for French fries or onion rings, and it'd be hard to get those. But if it came as a healthy idea, we could actually change the health of the community. Now, I love taking care of patients one by one, but in my public health role, I was responsible to think about this for the health of 2.5 million people. And my equivalent in San Bernardino, together, we're responsible for the health of 5 million people. How do you do that? I mean, it's kind of a scary thought. Now, if we think about COVID, how did that work? Now, we're not physicians, we are nurses. Yes, we help coordinate to make sure that people got their vaccinations. But isn't that a public health success? If you look at the millions upon millions of vaccines were given out just in the Inland Empire, 75% of the people have had their 2 vaccines. And how many thousands of lives got saved just because of those vaccines? Now, we knew what to do because in the big flu epidemic of 1918, every mistake that could be made was made. So public health knew what to do, but we were thwarted at every aspect because of other people, politicians, that knew better about before there was vaccines, there shouldn't be masks, or the schools should stay open, or people should congregate together, and with predictable results. So from a public health perspective, there are so many opportunities. I've talked here about 1, 2, and 3. 3 is also what we would call diversity, equity, and an inclusion perspective. But you heard from the rocket scientists, we have many scientists working in public health. In a way, the nutritionists are scientists. We have health statisticians that we call epidemiologists. Esther, I wish she was still on. We have CPAs because all that federal money coming in needs to be spent properly and keep me from going to jail for fraud and abuse, right? And we need the biology people, because environmental health with their hazardous materials response, restaurant inspections, health inspections are key to the health of a community as well. Who would want to go to a restaurant that's never been inspected or that has a letter C in their window? Those are restaurants to avoid, if you clearly, and that it's not that hard to be a healthy restaurant, but you want to make sure that happens. Now, I haven't talked to Dr. Silva, but on that spaceship out there surrounding the moon, we got to find a way for those, I don't know if they're called astronauts or what they're going to be called, moonanauts. They still have to eat healthy. They have to be physically active. What are we going to do if they get a chronic disease, diabetes or cancer, and you can't fly them back right away? So the public health perspective of how they're going to keep those people healthy needs to be first and foremost. And for all of us, think about the world if we built it differently. Think about if the easy choice was walking a block or two to the store. Think if the easy way was the healthy food was cheaper. Think of it as the healthy food was the first and second choice. Think about it as, hey, my last 6 months in public health, I had a stand-up desk. I lost weight. I was healthier because I was standing instead of sitting at my desk. And all it took was a very simple electric desk that went up and down, and it cost very little compared to the other desks. And then everyone who wants to come in my office had to stand up for our meetings. The meetings were more productive. They were shorter, and we got more done in a short amount of time. So we can build health into everyday life. It doesn't have to be the afterthought, oh, I have to go to a gym, or did I eat healthy today? No, eat the fruits and vegetables. Chicken instead of beef, if you can do that. 10,000 steps a day. Hey, everybody at the convention in Nashville walked at least 10,000 steps a day. Get your vaccines, get boosted. Ensure everyone has all the vaccinations and immunizations they need as kids, and we can create a healthy community. Right now, our death rate is the highest it's been in generations. Our average life expectancy dropped just because of COVID. We can turn that back around. And I'd be remiss if I didn't say, remember, no smoking. No smoking. Always wear that seatbelt, because that's everything you do every day makes a determination to help you live a long and healthy life. Public health.